Hi, everybody. Welcome. We'll get started in just a minute or two as you're all coming in. May I ask all of you to make sure you're muted? Very good. Okay. Another minute and we'll make sure we're all here. Still have people joining us. Welcome, everybody. This is a good thing to do over lunch, right? Welcome, welcome, everybody. I have given you the permission to rename yourself. If you would like to rename yourself and say your name as well as your agency name, that would be great. If you'd like to do that so we can see where you all are calling with. All right, well, I've got 12:31 by my watch. Oh, good, thank you. I see everybody's renaming, good. So we will go ahead and get started. Welcome, everybody. My name is Wendy Himes. I'm the Director of Conferences and Memberships here at Vision Serve Alliance. And I'm thrilled that so many of you are signed up for today's discussion. And we're going to turn it over to you. We realized that it had been a while since we had had a discussion with all of our members on COVID safety protocols. I know we had our State of Vision Rehab calls every week last summer about this time, where everybody could share resources with each other and ask questions as we dealt with this issue. So it was brought to our attention by Mary Junela. Thank you very much. That she would like to have an update on some of these issues. And we said, that's a great idea. And let's bring everybody together to give us an opportunity to talk about some of these issues. We are very grateful for Mary for bringing this issue and forcing us to think about how important it is. And Mary, I'll throw it over to you to tell us a little bit about how you've been dealing with this at your agency.
Sure. Well, thank you. Well, first of all, hello, everybody. My name's Mary Junela. Again, I'm the Executive Director of the Lighthouse Center for Vital Living in Duluth, Minnesota. We used to be known a couple different names, the Duluth Lighthouse for the Blind, and then we transitioned into being the Lighthouse Center for Vision Loss. And about a year ago, we officially expanded our mission to be working with people across disability areas and older adults in general. So hence the name change, Lighthouse Center for Vital Living. And I'm telling you that too, because the mission may be important to this discussion as well. It may not have any bearing, but we do work with people, a lot of older adults. We are working with people across disability areas. So just keep that in mind as you hear kind of the journey that we've been on. And so yeah, I'd like to give you a little background for how this came up. I know you all are dealing with the same thing. I am incredibly curious and eager to learn from all of you and your wisdom of how you've thought through these issues. So I'm really grateful to Lee and to Wendy for bringing up this discussion group. So our situation is, just so you kind of know the specifics, it was literally, we, like many of you, we basically closed down our in-person services during the pandemic. We didn't have any center-based clients. We were seeing people remotely, and we were, if somebody really needed service, we were seeing them in person, that kind of thing. But But we never said we weren't going to see clients at our center. We were going to, take that on a case-by-case basis. And we do have a couple of clients back now. We're a small organization. We don't always have center-based clients. A lot of our work is itinerant and in the home. But anyway, it happens that we were having a client coming to us. And kind of at the last minute, I learned that she was unvaccinated. And I knew that we still had a number of staff who were unvaccinated. Some of them for temporarily, we had a new mother, and we had a woman who was pregnant. They planned to get vaccinated, but they weren't, kind of thing. And then, as it happens, just as the perfect storm, we also had a staff exposure. One of our staff members, his whole family tested positive, and he had just been in our facility. So all of this was coming together at the same time. And I'm thinking, and our drivers were not vaccinated. So we've got all of these people, and so it really was a wake-up call to me of, now that the vaccines were available and a lot of people were getting vaccinated, wow, what are we going to do with this? Another wrinkle with this, that is that the Lighthouse, we are what the state of Minnesota called CCC, a COVID community coordinator, meaning that we're getting funding from the Minnesota Department of Health to help people through the pandemic and to encourage vaccines and help with vaccinations and that kind of stuff. We have a campaign that we're sponsoring right now that's called Be a Health Hero, and kind of who will you get vaccinated? So we have a role in the community that's really encouraging vaccination. In addition to kind of the service models that I've talked about, we are also serving school-age kids. We have contracts with the schools to be serving those individuals, and we have a transition program that we go across the state of Minnesota. We pick up kids, we bring them to the Lighthouse, and we house them here for weekends. We haven't been doing that recently. It's all been virtual camps, but that is our model. So, as we're thinking about how we're going to handle all these things with vaccinated and unvaccinated staff, and what's our policy for clients, et cetera, we realized that we just were not prepared for what was ahead of us. I will say we also had a variety of staff responses. What I ended up doing to handle the situation that came up is my board was not comfortable with having unvaccinated staff members with unvaccinated clients and drivers. So I had to separate people. We didn't say that we weren't going to serve the client, but I had to keep the unvaccinated staff members away. And it was difficult because some of these people were key instructors, our drivers. So it ended up falling a lot of burden on the staff members who are vaccinated. And we also happen to have staff members who have compromised immune systems, going through chemotherapy. So, we just had a lot coming at us in these considerations. So we decided that we needed to look at all of these policies and these considerations, and not just the vaccination policy, but really looking at it alongside with how open are we going to be? Are we going to serve people in person? Are we going to require masking outside? And so what Wendy, I sent to Wendy, and I guess it's in our policy. Where is that? Or anyway, what I'd like to do is just kind of quickly summarize our thinking and the policies that we have come up with as a proposal. So we have a committee that came up with these policies. It has not been approved by our board yet. I would love feedback for us, but I'm hoping that it's also a good way to kind of jumpstart this conversation for all of you as well, if that makes sense. Should we jump into that, Wendy, or do you want to have some other general conversations first, do you think?
We can start with a few poll questions. Actually, I think that would be the best the best
Okay.
thing to start with. So give me just a moment and I'll bring the first of those up. Okay. So we had entered a few poll questions just to get us started. And let me bring that first one up here. Okay, so this first one I'd like you to look at question number 1 and number 2. Ignore the rest, those I've separated those, but you'll see question number 1 in a moment here. So question number 1 and 2, we can answer together on this poll. The rest I've separated. So question 1, as of today, what percentage of your employees work from home? Your choices are 100%, 75%, 50%, 25%, and less than 25%. Go ahead and click your answer there.
Can you hear me?
Yes?
My name is Bill Kirby. I'm with the Arizona Center for Visually Impaired. I'm standing in for Steve Tepper. I'm visually impaired, so I can't see the questions.
That's strange. My understanding was that Zoom it should read the questions to you or the polls. But if you'd like to enter your answer in the chat, that would be great too. So the question was, as of today, what percentage of your employees work from home? Is anybody else having issues with answering these questions? Oh, it's asking you to answer all the questions. Okay, let me start with a different poll then, since okay, that one is asking you to answer all of the questions.
Okay, let me see if I can find that. And I'll mute myself so you don't have to listen to my jaws.
Just a moment. I'll get this fixed out.
This meeting is being recorded. F6, Zoom alert, Zoom poll has been locked.
Nope, that's the wrong one. Okay, I'm going to go in and delete that one so that we have single questions.
Zoom meeting.
That's right.
East Miller, Missouri Rehabilitation Services for the Blind Edit. Type in alert, Zoom poll has been locked.
Okay, let's try this one more time. Nope, it is still having everything there.
Input chat text, East Miller, Missouri Rehabilitation Services for the Blind
Well,
Edit.
I am sorry about that.
So let's just ask the question and discuss it.
Type message here.
Yes.
Okay.
So the question was, what percentage of your employees are working remotely?
Activate, press space bar.
So if anybody would like to type your answers in the chat, we can certainly do that.
Elapsed.
And then we'll open it up for discussion.
Just approximately.
Leave, alt plus Q button to activate. Meeting information button to activate. Another.I left parent Q button to activate. Press space bar. F6. This meeting is being recorded. F6. F6. Zoom meeting. Q button to activate. Press space bar.
What is your name from Arizona again? I'm sorry, I missed your first name. Bill?
To open live transfer right parent. Meeting information button to activate. Leave, alt plus Q reactions button to activate. Press space bar. Record on this computer left parent alt plus R right parent button to activate.
Who is that? Is that you, perhaps, Zizi? That are you using JAWS?
I think it's the person who is standing in for Steve Tepper.
But he's muted.
Oh, it must be somebody else.
Yeah, we're hearing somebody's JAWS reading. So
It's Mr. Miller.
that's Mr. Miller. Okay, so if
They're muted now.
they're muted now. Thank you. And when you want to talk, of course, unmute yourself, but it's just helpful if you do that in the meanwhile. Thanks.
All right, so I'm seeing lots of answers here in the chat. So right now we've got, wow, so many different answers. Less than 25%, less than 25%, 75% remote, 75% remote, 25% remote, 100% remote. That's Ann Cilius, I believe. I'm reading her correct. Ann Cilia, excuse me, from Delta Gamma. 75%, but all of those staff do work at least one day or week in the office for in-person appointments. Staggered schedules, everyone is in the office at some point, 25% to 50%, and less than 25%. So quite a variety there. If anybody would like to say something more about any challenges that you have encountered with this kind of schedules.
Hi, this is Sarah in New Hampshire at Future Insight. So we're about 75% remote, but I will say that a good number of our staff is itinerant. So
Mhm.
it's not vastly different at this point. We're actually pretty close to our pre-COVID in the office numbers at this point. But I am hearing more and more from staff that they are feeling disconnected from other staff. And we've tried a variety of things, but it's not feeling the same to people in terms of, you know, day-to-day collaboration and so on. So obviously not for this meeting, but it's something that's really creeping in at this point for us.
Yeah, I think we've seen a lot of evidence of how the remote work environment. I mean, it's not just that they're not in the office. I think there was so much anxiety too, but a lot of pressure on corporate culture for our organizations. And you know, that's the balance that I think we'll need to hit is, I think there's a lot of advantage to employees to be able to at least work part of their schedule not in the office. And like you said, Sarah, a lot of our positions have always been itinerant and haven't worked out of the office. But how do you keep them connected? And how do you keep that team and core values and, you know, maintain that when so many people are not in the office?
I'm going to go ahead and share our next poll question. I figured it out. So this question is about masks. Are you requiring staff and or clients to wear masks? And it should allow you just to answer with this one question. Please go ahead and answer your question. Okay, I think we'll give you another 10 seconds. I think everybody's put their answer in. Thank you. Here we are. So here are your results. So 60% are requiring staff and or clients to wear masks, and 40% said no, they are not. That is pretty close. Pretty close. Would anybody like to discuss anything about the mask issue?
Yeah, Dina, like to share your comment?
Sure. So we literally today just are announcing that we are eliminating our mask mandate for any staff person who is vaccinated and any client that is fully vaccinated. So that's just going into effect today or the next couple of days. And I just want to add from the last comment, we've seen a couple of people take retirement and leave employment at the Carroll Center, not that many, but I find that the back to work challenge is more about people who have children or other family in their household and have sort of gotten into a sort of routine, and they're more challenged to get back to campus because they like the routine they created at home. So we're kind of working with it. I think we've still let people work at home a little bit in the future, but because we are open and providing services, most of our teaching staff is on campus and many of our managers are on campus, but there are some challenges.
Yeah. And how about you, Anne? Would you care to elaborate on what you put in the chat about this?
Sure. This is Anne with Delta Gamma Center. We are still working on our protocols right now, so we haven't rolled it out, but that is the plan, that we would require masks. However, as we are working on it, there's definitely lots of challenges, particularly like if you do home visiting, that's kind of putting our staff in an awkward position to require a parent who is fully vaccinated to wear a mask in their own house. We're also seeing some of our outdoor activities with our older youth. We have a tandem cycling team. And so we have cyclists that are riding their bikes in 90-degree weather with humidity, wearing masks. And if they're vaccinated, do they need to? So these are, again, why we haven't rolled it out, because all these things are still out there and we're trying to figure them out, and figuring out a way to do that isn't discriminatory and isn't calling people out for who does and who doesn't. So there's a lot of challenges, but definitely between the different audiences, different pieces that all come into play.
Thank you.
Yeah. You know, I will say that as our committee discussed this, the devil is really in the details. It really is the nuance of these needs and of the policies. As we got into those more, we really did a flip on some issues that we thought we were going to come out on a different side on. So, you know, I just want to share that discussing the specific, you know, what do you do if, and because that has many different ripple effects and implications, that it drove some of our policies in a direction we didn't assume they would.
Yeah, I have our next poll question is about social distancing between staff and clients. So I'm going to go ahead and launch that.
Before you do that, can I ask a question?
Oh, sure.
Is anyone differentiating mask requirements for staff versus mask requirements for clients?
Good question.
Yeah, I think that's a really good question. And that's kind of an example of the details. I mean, we know that we are going to be serving clients who are not vaccinated, either because they can't be vaccinated or because they refuse to be vaccinated or because they're too young to be vaccinated. So, you know, in our draft of our policy, what we ended up saying is that we think it would be really awkward to try to require masking for clients who are unvaccinated if we are not also masked. So part of the reason we decided to continue with our masking policy, when we're out around people in our offices, we can take them off in our own offices, but is exactly for that reason, that it would be too difficult to enforce that with individual clients.
Good question. Yep, it is. Multifaceted answers. I'm going to go ahead and relaunch that question here. So the next question was about social distancing with staff and clients. Are you allowing an unvaccinated staff member to work one-on-one with an unvaccinated client, not with distancing all the time? I know that Mary had said there's so many instances when you're giving teaching O&M and TBI, and, you know, is it really possible to do that with social distancing? So I'll give you another 10 seconds to get your answers in there. All right, looks like we've got everybody's answers. So we have 33%, 3 people answered yes, they are allowing unvaccinated staff members to work one-on-one with unvaccinated clients, not with distancing all the time. And 6 of you, or 67%, said no. Any other discussion you'd like to have around this social distancing issue?
I'll just read what Sherry put in the chat. She answered yes to that question, but the staff are wearing face shields, masks, and in some cases, disposable gowns.
Yeah, can I say I was also not sure how to answer that, because we, I mean, there are things that we have to do where we have to get close. So we're not necessarily saying no, but all of our, if we have an unvaccinated staff member, we're limiting that kind of service to outside and that kind of thing if we can, because at this point most of them are vaccinated.
Ask a question. And this may be one of the upcoming poll questions. So feel free to put it off. But at Future Insight, we've, goodness, so many conversations. But at this point, we're not requiring staff to be vaccinated.
That is the next question, Sarah.
Okay. Do you mind if I keep talking, or you want me to wait?
Let me launch this poll, and then it's exactly that question. You know, how many of you have a policy regarding? How many of you have a policy regarding the vaccination of staff and or clients? Yes or no, or still developing, are your possible answers.
I don't think I understand the question.
The question
I
is
have a policy
simply,
that says we don't require vaccination, so I don't know how to answer.
Then you have a policy.
Okay, that's what I put. Okay.
You either do have a policy or you don't have a policy about vaccination of staff and clients, or you could say still developing. All right, I'll share the results. So the top result was no, we do not have a policy regarding vaccination of staff and or clients. 5 of you said no. The next answer was yes. 4 of you said yes, we have a policy, and 3 of you said still developing. So it's wide open for what we are doing with that issue. And now, Sarah, would you like to ask your follow-up question?
Well, I was just going to make a note that one of the more complex factors we've run into is the HR and privacy and HIPAA laws around staff. So we're not technically requiring that anyone be vaccinated, but since some of the outside sites that we go to and provide services require that service provision be done by someone's vaccination, what we've done is kind of done this dance around, you know, who is willing to disclose their vaccination status to an outside entity, whether it's a client or a facility. And so we've kind of made this list of who's willing to disclose that they are vaccinated, but we're not asking it from an HR perspective to put in their file. It's a very interesting dance.
Yeah. Gee, well, if you're in the state of Florida, you might get fined $5,000 if you ask them to show your vaccine card, right, Shit?
That's why we're not touching that one. We're not touching it.
We live in a crazy state.
Yes, we do.
Is that a discussion, or is that
No, our state legislature passed a law banning the use of vaccine passports, but that means also requiring to show anybody that you've been vaccinated,
including employers?
Yeah, everybody.
Oh,
That's an icky one, because Florida, we have Florida law, and then we have the federal guidance. The federal guidance tells us, yes, employers can require vaccination.
Yes, they did.
But then the Florida guidance is more so we can't turn away people from our businesses if they're unvaccinated. But it doesn't really get into employment. That's my understanding, Lee, that it doesn't get into the employment part of it, but we can't tell a client they can't come in if they can't show proof of vaccination.
Yeah, I think you're right. And where we're seeing it in the news just for fun is with the cruise ships, because cruise ships are requiring all passengers to show proof of vaccination. And technically this Florida law then says they can fine them something like $5,000 a day as they require this. But most of the, as I understand, the cruise ships have told our legislature to screw themselves.
Yeah. So states may be really different. We actually did consult with a lawyer on this, and in Minnesota, I'm interested to see, that's Dan from Vision Loss Resources. You're saying you cannot require staff to disclose health information, including vaccinations. Interestingly, that's not the opinion of our lawyer in the state of Minnesota. And he feels very solid on that vaccination status is not protected health information. The information that we're hearing is that we can ask and we can require, but how, if somebody doesn't want, if somebody says no, they haven't been vaccinated, how we ask that question as to, well, why are you not vaccinated? That's where you could get into trouble. So you can ask them whether or not they're vaccinated, but you can't ask about protected status as in disability and that kind of thing. So It's just, you have to be very careful how you ask it, and you also have to be careful what you do with that information after you have it. But employers, at least according to our lawyer in Minnesota, can certainly ask that.
Yeah, and in Canada, it's you can't ask that. There's been a couple, I've been involved with a number of pieces where we've communicated to staff like when they're eligible. And staff, because the bulk of the people who work for our organization, I mean, they want to be vaccinated, right? They believe in it and all that kind of stuff. So they'll tell me, and they're comfortable sharing it. But healthcare information is considered private up here. So if my employer asks me stuff that I don't feel comfortable with, including like if it's a sick leave or something like that, I don't have to disclose what my illness is. And it's yeah, same applies to vaccines.
Interesting.
So our like a lot of our return to office plan for this whole time, like I'd say for the past year and a half, all of our offices have been in Canada have been open by appointment only. So client schedules to come in to see a staff person, we meet them at the door, let them in, doors locked again, right? But all of that, when they're inside the building, it's quite strict protocol, right? You come in, you wash your hands, or sanitize. There's social distancing. There's you know, your barrier between clients. Everything's really really sanitized. So if even going forward, if I knew that a staff wasn't vaccinated, that our COVID protocols are still going to continue. And it's not really something I can enforce to the staff and say, no, you need to go get vaccinated. Right?
Yeah, very interesting.
I'm very surprised to hear that. I thought for sure, you know, you guys would be the same, and that it would be, you can't ask that because it's private healthcare information. It's personal, private.
And another interesting thing about Florida with our governor is that any public building, they removed all mask mandates. And so we're located on a college campus. So that wiped out any mask mandates that we were intending to have. So there are a lot of layers to it. But for our policy, because there are just so many layers, we went with a live and let live sort of approach to all of it. That at this point, if you made the choice to be vaccinated, we are going to allow you your freedom to go face naked. And if you have made the choice not to be vaccinated, then we are requesting that you wear a mask. But for those of us who are vaccinated and made that choice, it's not going to affect us one way or the other.
Yeah.
But if you're wearing, request that you wear a mask if you are unvaccinated or if you don't wish to disclose your status. So
the safety protocol piece for us here is that we can mandate, right? So all of our staff, they're required to wear masks, and any clients coming into the building, we can require them to wear a mask. We also do quite a thorough screen. Like I think it's probably 10, 15 questions that we ask to make sure a client doesn't have symptoms, haven't been out of the country, that kind of stuff, right?
Yeah.
I foresee that continuing for, you know.
Well, that's really the safest thing to do because all those things protect you from more than COVID. So
they do,
it makes
yeah.
sense.
Okay, I'll go ahead and this is a nice follow-up question. It has to do with this exact discussion. Just so we know wherever all of our agencies are standing on this. So are you requiring staff and or clients to be vaccinated? Perhaps we should just narrow that down to staff. Are you requiring staff to be vaccinated? Go ahead and enter your answer there. Yes, no, or just staff. All right, we've got 9 answers in. Okay, so we've got everybody in there. All right, so here are your results. So yes, Seth, 2 of you are requiring staff to be vaccinated, and 9 are not requiring staff to be vaccinated. Yep. it's a difficult issue to require. Here's a follow-up question for this. Are you trying to limit unvaccinated staff members' exposure and instead asking vaccinated staff to do this work? Yes or no? How are you mitigating risk for your staff? I'll give you another 10 seconds to get your answer in there. All right, I think we've got everybody's votes in there.
Okay, sorry about that. Thank you. I'll bring my slides. Yeah.
So here are your results.
Oh, you're welcome.
Where you been?
So by and
Where
far,
you been?
Here?
Oh, your doors were shut.
I'm so sorry.
Oh,
Could you have you
I was at
mute
a-
yourself because we are not able to hear. Someone has their.
You're on the call with 15 people. I
Tammy,
think,
Terry
Tammy
wanted me
needs
to-
to mute. We can hear her. We can hear Tammy's conversation.
what are you eating?
Nuts.
Oh, good.
Oops, sorry. I'm not muted.
There we go. I just muted Tammy for her. So the results for are you trying to limit unvaccinated staff members' exposure and instead asking vaccinated staff to do this work? By far, no was the largest responses. 9 of you, 82% said no, and 18% or 2 of you said yes. Very interesting options. What would you like to say about that? I know, Mary, you're the one who submitted that question.
I mean, for us, I think that's what's pushing us in the direction of the mandatory vaccination consideration, because we don't want to be in the position of requiring staff. We have done that temporarily in the situation that I just described. We knew that we had an unvaccinated client with some health issues, and we knew that we had unvaccinated staff. And we knew that we'd had an exposure in our building. So we just, I just felt like we couldn't proceed in that way at that moment. So.
And Sherry Raisler said in the chat, we have to be very careful in how we assign work because it can be considered discrimination if you base it on vaccination status. Would you like to elaborate on that, Sherry?
That's just in conversation with our HR company. Initially it was like, can we bring just vaccinated people back or different things? And so they were very clear that you cannot have a policy for one versus the other. Also, clients are saying we want an unvaccinated or we want a vaccinated staff person. You also cannot disclose or do that. You can only say what % of your staff are vaccinated. So basically that's why it's a mask mandate in our building, and any client interaction, that's the way we have to do it.
So you're in California, so you still have those mask mandates in place?
Yes, June 15th. So next Tuesday is when the most of the restrictions in the tiered system will be lifted. But again, because of our clinic, we're considered a health center. And so we are permitted, obviously, to have mask mandates. So we are doing that.
Mm-hmm.
Very good. Anybody else want to share on that?
And just a time check, we're a little more than halfway through. I don't know how many more questions, but if a lot more, you might want to prioritize.
I think I've only got 2 more in the poll. I think there's one more.
Okay.
There's an additional one I didn't get entered in there, but here's the next poll question. Is regarding public transportation in your clients. Are you taking youth clients who are not vaccinated on public transportation for training? Yes or no?
Yeah, for training or transition activities, anything.
And Chantel has put in here, yes, with parent permission. Yes. Okay, I'll give you another few seconds if you haven't gotten your answer in there. Okay, so here are the results for the poll. 67% said no, you are not taking your youth clients who are not vaccinated on public transportation for training, and 33%, or 3 of you, said yes. So how do you develop your policies on that?
For us here in rural Central Florida, where it's the same extension of our live and let live, policy. If you are not vaccinated or not wishing to disclose your status, then you're wearing a mask for all of our activities. So that would mean that our kids are going to be wearing masks for our activities, and we're going to attempt to distance on the. I don't think we're going to go on buses, but we're going to load them up on vans and stuff like that this summer. But they're going to be wearing masks for sure. And some parents aren't comfortable with that, and so we won't be doing that with those kids.
Mm-hmm.
We did talk about, having parents be able to sign off on it. We had some members of our board committee who weren't comfortable with that because kind of informed consent of the youth and that kind of thing. We even had a discussion whether adults should be able to make that decision for themselves, but we did decide that adults can make that decision for themselves if they're unvaccinated, but we didn't want parents making that decision for their kids. That was the feeling of my board.
So who's making it for them? You guys?
So we won't take an unvaccinated
got it.
minors onto public transportation.
Okay.
So I don't know if anybody has any reactions to that, any of this that I'm putting out there. I'd love feedback on.
Oh, I answered no because we only service adults at the Arizona Center for Blind and Visually Impaired.
Okay.
Mm-hmm.
Mary, the conversation that went down with my board, we had very strict policies at the beginning. We were closely following all of the CDC guidance, and it all changed when the CDC made the world free again.
If right.
And so if at the beginning, when we're closely following all of the CDC guidance, and then all of a sudden we're not,
Mm-hmm.
it just didn't make any sense. And so when the CDC released the new guidance freeing up the world, that's what our policy turned into. And we already said it, but we're going from the perspective of if you wanted the vaccine, you've already gotten it, or you have a plan to get it. So those at this point, if they don't want it, we can't stop the world for them. It was a feisty board meeting for sure.
Yeah, and I think for us, we started out there. And then we kind of, like I said, our policies evolved the more we talked about, because we realized that there are people who can't be vaccinated. And, kind of the idea you get vaccinated for somebody else, and you wear a mask for somebody else as opposed to just for yourself. So we know that there are staff members, and our feeling was we know there are vulnerable people that would be affected by us not having mask wearing and or not having our staff vaccinated. So it was kind of which side of the risk do you go on? I mean, either way you go, it's a difficult decision. But that was the thinking of our group on that, is protecting the vulnerable. And there are people who need our services who cannot be vaccinated, or even if they are vaccinated, their protection is going to be limited.
Mm-hmm.
And that absolutely came up in our feisty board meeting, and we went with we can be asked to wear masks at any time. If before you go into a client's home, if you offer, would you like me to wear a mask?
Mm-hmm.
And we offer that. If parents want us to wear masks around us vaccinated folks around their kids, we absolutely will. And we make sure that they know that because we don't want to put folks in danger. But we're going at it from the approach of you gotta speak up for what's right for you. You gotta do what's right for you. So we embrace the gray area.
Yeah, it's hard, it's really hard.
Yeah.
And the policy that we haven't adopted it yet, so we may still have those feisty decisions in the board context, but the recommendation of the committee is quite conservative at this point. And which is why I was really anxious to get feedback and find out what other people are doing. But mandating staff vaccination as a condition of job, continued employment, because we can't work around it. The ways that we wanted to work around it just are not workable for us. And continuing with the mask wearing, at least for now, because we don't know which clients are vaccinated and which are not. And, so erring on the side of caution, but there's a lot of space where we can take off our masks because we have closed offices and that kind of thing. So yeah, feel free to push back, you guys.
Well, we're just finding that I find that with a lot of our senior population, they're kind of dictating to us that they don't want to engage in services, whether they're vaccinated or we're vaccinated or not. They're making those decisions. They're not ready. They want to wait till longer. Yes, I'm vaccinated, but I'm not ready to go out. And I think families for more of our school and individual lessons are kind of doing the same thing about the engagement of services and at what level. But we have been open since September with our campus services and dorm, and we are fully open for our summer youth programs. And we are kind of shocked with the number of students we are getting this summer. And I have wait lists for most of our programs. And our younger programs, our 8 to 14-year-old kids, many of those kids are not going to be vaccinated. And the parents are okay with them staying on campus, sharing a room with a kid who may or may not be vaccinated. Certainly, they're not going to sleep with masks, but during the day, they're going to have to wear masks. They're going to go out on public transportation. The staff are not going to, most of the public transportation isn't busy anyway, so they're not going to get on a bus or train at 8 in the morning. But even if they do, there are not too many people on them. So they're just kind of picking and choosing and using more cars. But, we're in Massachusetts. We're fortunate that a lot of people have accepted vaccines, and a lot of, even without asking, we already know that for our kids who are 14 and up, 90% of our kids are vaccinated because they've already offered that information.
Wow.
So, and we're not requiring it, strongly encouraging it, but they're easily saying, my child's vaccinated, do you want to see the card? And we're like, no, we don't need to see it, thank you very much, but we're tracking it just for our own knowledge.
Did you consider making it a requirement as a condition of, staying in the dorms and that kind of contact?
The board did not want to do that. We're not requiring it. We're not requiring that they show us anything. We're going by what they tell us anyway. And we have many clients who are with us who've gotten their vaccine while they've been at the Carroll Center. So we've given them the time and supported them to go get their vaccine, and the same with staff, supported people to take time off and not have to use sick time to do that.
Thank you for sharing that.
Yeah.
And Tiffany Walker has a very different experience for her summer programs. Tiffany, would you like to share what challenges you're dealing with? Not sure. Tiffany is still on mute. There she is. Tiffany,
I'm trying to unmute the video.
We hear you.
So I'm actually Cindy Miller. I'm sitting in for Tiffany. I'm the Children and Youth Program Manager. And so what's happening for us is we had a lot of parents checking in with us during the spring saying, when are you going to be back in person? When are we going to be able to do camps and activities? And so we planned a whole summer packed with camps. by whole summer, I mean an extremely shortened summer, because we have school districts that are going all the way through June 18th. So we usually don't start programming until after school is out. So then we also have school districts that are going back the second week of August. And typically we don't go back until usually the third or fourth week of August. So we put out all the camps, we put them on Eventbrite, the same as we always do. And we have had no registration.
Wow.
Oh my gosh.
What
Where-
state are you located,
Yeah.
Cindy?
We're in San Antonio, Texas.
Uh-huh.
And so
Yeah.
we are actually we just canceled all the summer camps.
Mm.
And we are going to reorganize, and we're going to do some fun in the park days. We are going to take the big yard games like the horseshoes and the cornhole and the giant checkers and the giant Connect Four. And I always adapt them with tactile materials and beepers and whatnot. And we're going to have game days in the park, and we'll play on the play structures, and I'll take a big box of Chick-fil-A and we'll play for 2 hours and be done. And we'll see how that goes, but we'll be outside in the wide open. We did have very good attendance for our beeping Easter egg hunt, and it was out in a very large outdoor venue, and I set it up so that it would be a loop. So families would go through the loop and do activity, and then out the door. And so there wasn't a lot of gathering of multiple families. And that was very successful. Everyone was really happy with that. But I don't know what's happening for the summer. So here we are.
Do you have feedback from folks on why they're not ready to move forward with in-person camps?
We have not been getting any feedback. We have done polls, and in the polls, the parents are saying they want virtual and they want in-person, both. And even for our virtual, we have signups, but no one's showing up.
Mm-hmm.
Whereas last year, we did 42 camps and challenges remotely, and we were packed with kids. But I think that last year, we as a children's program didn't know what to do. So we just we throw it out there. We did everything just to see what would stick. And I think that our families also didn't know what to do. So they just signed up for everything and did everything. And this year, everyone's exhausted. I think they're just tired. I think they're tired of it. I think that we have enough kids who, in addition to having vision impairment and blindness, also have other health conditions, and parents are not comfortable exposing their kids, in a confined space. We still have a lot of kids that are not returned to school, even though the schools are fully open. Mm-hmm. And so I'm going to see how game days in the park go.
That's Cindy, thanks for sharing that. That's really interesting. I'm wondering, the contrast with what we're hearing from the Carroll Center is really marked. I'm wondering, what is the state in Texas right now in terms of vaccination rates and all of that? Is it a low vaccination rate at this point? Is that part of this, do you think, or?
It depends on where you are. San Antonio has a very high vaccination rate, but we're one of the blueberries.
Okay.
Interesting. Well, we are drawing to the end of our time here. One of the nice things we have to share with you, Mary has her preliminary COVID-19 vaccination policy and other safety measures document that she was the draft, right? It's still it's in the approval process, but we have that in our Google Drive shared folder, and I'm going to go ahead and put the link to that in the chat for you so that you can see what her organization has drafted for its policies. I'm going to put that in the chat right here.
And we very much appreciate you being willing to share that, Mary. Thank you.
Well,
Right.
yeah, sure. And, you know, I'm happy to share it. You know, if it's useful to anyone else. I'm also being somewhat selfish because I would love feedback, pushback. So please feel free to do that now or afterwards.
Yes, and so this is actually the link to the folder, and you have with this link you have permission to download her document, which is in there. You have also permission to upload your own, or you can email it to me, and I would be glad to upload it for you. We would, again, this is one of the things that we shared last year was what are your COVID-19 safety protocols? Let's share that with each other and see if we can help each other with some language that would work. So my email is just wendy@visionservealliance.org. And I'm putting it in the chat for you. You're welcome to, again, upload it at that Google Drive link, or just email it to me and I'd be glad to upload it. This meeting obviously is being recorded. We will be sharing the recording with everybody so that other people who have questions can learn from it as well. But please continue to share any thoughts you have with us, and we'll be glad to share that with everybody, or just upload resources that you have that might be helpful for everybody in this Google Drive.
Can I just ask, I think we asked in the survey, you know, how many people have a policy? I just want to get clarification. Is there any, are any of you considering, you know, closely considering, think you probably will mandate vaccines? If anybody wants to share, is it?
Mine's an absolutely not.
Okay.
Yeah, it won't happen in Canada.
Okay.
The Arizona Center for the Blind and Visually Impaired has mandated vaccines for those who work directly with clients.
Okay.
Sarah at Future Insight says no. Dina at Carol says no.
I'm under the impression we can't mandate. You can only highly suggest and highly encourage, but you can't mandate.
And why are you under that impression? I'm just curious.
State of California.
Oh, you know, and I can't speak to that, but I know that our lawyer's opinion, and you know, and even the policy guidance federally says that employers can mandate. So I'm surprised how many people think that they can't mandate it, I guess, is with that. But so I'm hearing just one other organization has done that, and that was where, Steve?
Arizona.
Okay.
Arizona.
So one other, and is that problematic for you, Steve? Are you getting any? I mean, I don't know how long you've been doing that, but how is that going?
It mixed. Most of the staff is on board. Those who aren't will be offered to work remotely.
I see. So you're not going to let anybody go over it?
Not if we don't have to.
Okay. Okay. And there's nobody else who is either doing it or who is actively considering doing it. Is that what I'm hearing? Okay. Important information.
Yes, indeed. Well, out of respect for everybody's time, we want to just say thank you very much for joining us and for sharing all of this information. It's very helpful for us to see the wide range of tactics and policies that you're all developing. So thanks again, and to be continued. To be continued. Our hearts go out to all of you as you're wrestling with this.
Oh, yeah.
Okay. Thank you so much, everybody.
Thank you.
Thank you,
Bye-bye.
Mary.
Have a good weekend.
Thanks. Bye, everybody.
Thank you.
Bye.
Mhm.